Brandon Aiyuk of the San Francisco 49ers is carted off in today's game after what appears to be a significant right knee injury. Welcome back, everyone. My name is Dr. Stephen Wilson, and here on this channel, we analyze the mechanism of sports injuries. So if that's the type of content that interests you, then please consider liking and subscribing to this channel. Today's game between the Chiefs and the 49ers, Brandon Aiyuk, the receiver for the Niners, he's coming across the middle. He's making the reception, and then he's got a defender on his back and another one coming in from his lower right side who's going to make impact with his right leg, and the injury occurs to Aiyuk's right leg right there. We're going to look at that on a different angle here where we can get a better indication of exactly what did happen to his leg. So again, we see number 11, Brandon Aiyuk, coming across the middle. After he made the reception, he is being dragged down from behind from the Chiefs defender here, while the other one comes in from his right side, making contact with the front of his right thigh. When he makes contact with his right thigh, that's going to cause his right knee to bend backwards, almost hyperextending here. So we're going to inch it up just a little bit more so we can see right there. So what we want to look at, first of all, Aiyuk's right foot is on the ground, so it is anchored. Therefore, there's going to be more stress and pressure going through Aiyuk's knee. It's going to be bending it backwards. But his ankle, his right ankle here, does actually seem to, it does seem to roll inwards in an eversion type manner where it pronates. Because right here we can see the red of Aiyuk's cleat, which then becomes the bottom of his cleat there as his ankle rolls inward. So it is possible Aiyuk might be dealing with a right ankle injury here, but certainly we're looking at his knee. In this position here, we can see the full force of the contact of the Chiefs defender going through the front part of Aiyuk's knee. So if we were to draw a line down Aiyuk's thigh here, his right foot should be about where the cursor is, but his right foot is actually just there. We can see the hyperextension of Aiyuk's knee being forced backwards by the Chiefs defender, and that is really going to stress the structural integrity of Aiyuk's right knee. Mainly the ligaments of the ACL, the PCL, the anterior cruciate ligament, the posterior cruciate ligament, certainly his medial cruciate ligament, the soft connective cartilage that goes through his knee, the meniscus, and there is the possibility of a fracture in this instant here, because when his knee hyperextends backwards like that, the back part of his knee is going to stretch and almost separate, and the front part of his knee is going to bump together, the front part of his femur with the front part of the tibia. It can bump forcefully enough in some cases, possibly here, it can create what's called a tibial plateau fracture into the front of his right knee. All of those structures that I mentioned are certainly at risk of being damaged on this play. This is going to result in a significant injury for Brandon Aiyuk. We're going to correlate what we see here on the replay with the anatomy screen so we can further appreciate exactly what structures we are talking about here. So here we see a picture of the skeleton and all the bones in the body, but again, we're looking at the right leg, so we're just going to zoom in a little bit here. What we do want to focus on is around the right knee. So of course here we have your left and we have your right. The large bone on top here, that is the thigh bone, the femur, and then we have your kneecap and your patella right here in the front. The long bone of the tibia, that's your shin bone, with the fibula right beside it. And if we spin it around, we can look at it from the side. So when the force came in from the front, as we saw from the Chiefs defender, that's going to make impact in this direction. So that's going to cause a stress and a stretch of the structures in the back of his knee. It's going to cause a little bit of a compressive force in the front, and the compressive force of the femur and the upper part of the more proximal part of the tibia there, that bumping can create a little type of a microfracture into the tibial plateau. And here again, we look at a view from the front. Now, when the Chiefs defender came in, it wasn't from straight on into the exact anterior front of Aiyuk's knee. It was from the outside a little bit. So that's going to create a bit of a valgus stress on his leg. So the force came in from this direction, which is going to stress his MCL, his ACL, his PCL, and his meniscus running straight through. All those structures here are at risk from the impact on this play, creating that lateral force, that valgus force, which is going to really tension and stress the inside and the back portion of Aiyuk's knee. This is a significant injury. He was carted off on the field. Most likely, he will miss some time from this play. Thank you for watching.